Everyone, welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. And joining us this morning, we have Dr. Tori Haddad. It is good to see you. How are you?
I'm well. Thanks for having me.
Yes, of course. Thank you for being here. We're talking about how to prevent illness this winter. So you're an emergency medicine physician with Covenant Emergency Care Center, and you and your team typically see a rise in respiratory illnesses, of course, in the winter time, especially flu, COVID-19, RSV. So could you just share some tips on how to stay healthy and avoid these sicknesses?
Absolutely. We definitely see a big uptick in COVID, flu, and RSV during the winter and also after the holidays when people have gathered with their families and friends. And the best way to really prevent the spread of these illnesses is to wash your hands, to either wear a mask or cover your cough or your sneeze, as most of these illnesses are spread by respiratory droplets. And then also to remember that it's not too late to be vaccinated if you haven't already been. You can still get a flu vaccine or a COVID-19 vaccine or booster at any of the local pharmacies.
Tell me what role the vaccine plays in the prevention process.
Well, it's definitely helpful in the prevention. We've seen a huge decrease in COVID-19 among the vaccinated population. The flu vaccine is based on just a few strains of the flu, so every year it can either be really effective or somewhat less effective depending on what strain comes out and what's in the community. But regardless, having the vaccine is always protective, and it always lessens the severity and duration of your symptoms.
I can count my blessings. I have not, what I know, have gotten COVID yet, so very good to have these reminders and avoiding spreading the sickness. So on top of that, washing your hands, covering your cough, other ways to prevent the spread?
Definitely just wearing a mask if you're out in public, or social distancing as much as you can. Sanitizing sheets or towels or things that are shared at home amongst people if you have someone that's sick within your household.
Okay, very good. What is the, I guess, trends that you're seeing right now in terms of sickness and people coming in to see you?
Yeah, we've had a big uptick in the emergency department, people coming in with upper respiratory symptoms, so fever, congestion, cough, runny nose, and those body aches, those symptoms have all been very consistent with influenza A, which we've had a significant portion of our patients lately that have been testing positive for influenza A, particularly amongst the pediatric population.
All right, good to know. Is there anything else you would like our viewers to know just to keep themselves healthy, maybe their friends or family too?
Yeah, I think just, always to be cautious of making sure that you're washing your hands and that you're cleaning up, around the house and trying to keep your distance from other people who may be sick. And if you ever have any questions, the best thing is to try to call your primary care doctor first. And if you think you're having a medical emergency, then we'd be more than happy to see you at the emergency department at Covenant.
Very good. And stay home if you're sick, right?
Yeah, if you're sick, stay home.
Basic.
Yeah,
for
sure.
Well, we appreciate your time this morning.
Thanks for having me.
Yes, of course. And if you want more information on today's topic, just make sure that you head over to the Hot Links page that's on our website at WNEM.com.